We are bringing you live STEMI India 2018 from Lucknow. Let me introduce our guest. With me, Dr. Jabir. He is a senior consultant cardiologist, Lisie Hospital, Kochi, and he is a National Executive Committee member of CSI also. So let me begin with the questions. What are your major observation in primary angioplasty patients on registry in Kerala?
The primary angioplasty registry of Kerala may be perhaps the largest registry in the country in primary angioplasty. This is a project which was totally funded by the Cardiological Society of India Kerala chapter. We enrolled patients from the year 2015 to 2016 and followed them up for one more year. Around 6,000 patients across the state from 38 different centers. It's an unpublished data. The data is under analysis. What we found is that the mortality, the in-hospital mortality was close to around 4%, 4 or 4.8%. And 1 year mortality is around 7.5 to 8%. So this is at par with the European countries. So the primary angioplasty done in various parts of the state, they are getting a mortality rate or an outcome which is similar to that. The outcome is almost similar to that of an European country. So our standard of the procedure is excellent and is in line with all the major guidelines, or it's in line with all the major centers around the world. So we can do the primary angioplasty at a mortality rate and of course at a morbidity also we analyzed, which was also much less in tune with the other major studies. What we have observed is that the primary angioplasty should be the treatment of choice in acute myocardial infarction.
Right. So sir, in your opinion, what do you think, how can we place primary angioplasty and thrombolysis in Indian scenario?
The primary angioplasty is considered to be the standard therapy in acute ST elevation myocardial infarction across the globe. But though this is a guideline recommendation, in the practical scenario it is not possible even in many parts of the Western world due to a lot of logistical reason. When you consider our country, there are a lot of problems because it is not a country which is like Europe. It is not a country like America. Our country, different states have different problems. For example, if you take the state of Uttar Pradesh, my friend was telling today that a patient who is developing a myocardial infarction in Moradabad and you cannot transport him to Delhi for an angioplasty. It is impossible. So, lot of problems, especially one, transportation. We don't have the primary angioplasty facilities available in all major centers, even in all major cities across the country. So in urban areas, even in urban areas there are limitations. We don't have the facility. So there is no need to tell about the large rural area in the country where the northeastern places, the remote places of Uttar Pradesh, the remote places of the Himachal Pradesh, you don't have any facilities of primary angioplasty. And you cannot transfer the patient within 2 hours from this place if you develop a heart attack, and it is impossible to transfer this patient within 2 hours. For example, not even in the remote places, you look at the center of Lucknow, center of Mumbai, is it possible to transfer a person for within 10 kilometers in 2 hours time because of the traffic problems? It is impossible. So I think overall if you look at across the country, the most important thing is a timely reperfusion. You have to open the closed vessel as early as possible, whatever the mean you used. Look, you have two methods of reperfusion, opening up the vessel. One is thrombolytic therapy, the other is primary angioplasty. By and large, a large majority of the people don't have access to this reperfusion facility by primary angioplasty. So they should get an early reperfusion by a lytic therapy, but don't stop at that level because it is an incomplete therapy. So it has to be completed by an angiography and if needed an angioplasty. That is known as a systematic early angioplasty. So majority of them in our country, thrombolysis is still an option. Most important thing is we should reperfuse the patient at the earliest rather than waiting for a primary angioplasty. But in a state like Kerala, which is a small state, a lot of cath lab centered around in the areas where that means the urban areas, and there is no definite rural urban distinction. And we have another study which we looked into the geospatial distribution of the cath labs. It's a small state which has 110 cath labs across the state. So what we found that 75% of our population in Kerala has a timely access to reperfusion by primary angioplasty. In such a state, primary angioplasty may be the choice of reperfusion therapy, but across India it may not be.
Right. Thank you so much for sharing your views on the STEMI India 2018.